focus that we have for you this evening is the latest update coming from Delhi's prominent Lady Hardinge Hospital. The Resident Doctors Association of the hospital have written to the director demanding a rollback of the circular, which gives details, or you can say SOP, about how and what exactly the resident doctors should do in case they come in contact with a COVID positive person or they test positive. Now, the resident doctors have said that the circular is not acceptable. The circular has stated that the health workers exposed to COVID, irrespective of degree of exposure, need to continue working with a tight-fitted N95 mask, and that they must keep an eye out for any kind of symptoms that they develop. The resident doctors in response have said that adequate quarantine with testing facility is necessary to prevent the COVID spread. Listen.
As per the guidelines released on 5th of January regarding the quarantine for healthcare workers, it has been circulated that there is no quarantine for the healthcare workers even after getting exposed to a COVID positive patient, and they should continue to work wearing a mask and maintaining social distancing. So somewhere it is not a good practice, because it may increase the chances of spread of this virus in the healthcare workers. So we have written to our authority regarding the reconsideration and to do necessary amendments in the existing guidelines.
Well, the resident doctors definitely seem to differ from the idea of the hospital authorities. They are saying that somewhere the adequate quarantine facility should be given and the testing should be upped. This should not be the case that the doctor should be told to come to work even after getting in contact with the person who has tested positive, because initially we had spoken to the hospital authorities. They had said that this has been done keeping in view of the depleting manpower that they have. Over 40% of their doctors and the healthcare workers have contracted infection, and the numbers are rising, and they mixed the CDC guidelines along with the health ministry guidelines in order to circulate their own circular, in which they have asked the doctors to come to work with tight fitted mask and maintain a distance, and then treat the patients. And if they develop the infection and if the symptoms come, then they can go for testing and follow the health ministry's guideline, I beg your pardon. So here the doctors, resident doctors, have urged here the officials to change that quarantine norm, which they are currently saying that you have to come to work. They want adequate quarantine time and also adequate testing facility for the doctors as well as their family members.
Dr. Yatin Mehta, Chairman, Medanta Institute of Critical Care, is joining us on the broadcast this evening. Dr. Mehta, thank you very much for speaking with us here on Mirror Now. Now, I want you to explain to our viewers a little bit about what this circular really means. So there are guidelines for isolation. In case a doctor tests positive, then there is an SOP that needs to be followed. Then there is a different set of guidelines for quarantine in case a doctor or a healthcare worker comes in contact with a COVID positive person. Now, in that case, the circular says that you don't have to be in home quarantine, which is what the Ministry of Health circular mentions. It says you ensure that you have your N95 mask on and you continue to work, maintain social distancing. Your thoughts, sir, on this?
Yes, see, it is a bitter pill to swallow. No decision which is taken is correct, because if most of the doctors or most of the healthcare workers are exposed and they stay at home, who is going to look after the patients? Patient workload is increasing. Number of patients is increasing. So actually, this does make sense. But yes, there are two types. One must realize there are two types of exposures. One is high-risk exposure, where you're sitting pretty close to each other without masks, which people should not be doing anyways. Or there is a low-risk this thing where you are wearing masks, but one of the persons whom you are talking to has turned positive. So low risk is no problem. High risk ideally should be in quarantine for 5 days. But again, that luxury we may not have. So what we also have modified it is that if the healthcare worker is symptomatic, then obviously there is no question he should be tested. If positive, he goes the patient way. If negative, he keeps an eye and wears a mask and comes to work. Because we do not have this luxury of everybody, because the spread has become so rampant that virtually every healthcare worker would have been exposed at some point of time. And if all of them are sitting at home, who will look after these sick patients? So, I mean, it is not the best solution. But again, CDC also has modified its guidelines because of the shortage of manpower. So now they don't even recommend retesting at 7 days. And that is what we should be doing. There is no other choice.
Dr. Yatin Mehta, aren't we then risking the lives of these healthcare workers who probably had come in contact with someone, very close, and yet that person is coming, that healthcare worker can become a carrier also of the infection then?
See, risk is not so much to the healthcare worker as probably to the other colleagues of his or to his patients. Because if any point of time the healthcare workers turn symptomatic, he should be tested and he should be out of the workforce. But if he is asymptomatic and if it's a mild exposure, I do not think that they should be sitting at home. We cannot afford to do that.
Dr. Mehta, how was the protocol like during the second wave of COVID? Was it similar, or do you think now it has changed?
Yeah, it has changed now because obviously earlier we used to put them in quarantine if they were exposed. High risk exposure, low risk exposure, we were not quarantining them. But high risk exposure, even asymptomatic, we were putting them in quarantine for 5 days and then retesting.
What can be the balanced approach in a situation like this? Because now there's a demand coming from the resident doctors of this particular hospital as well, that there should be some kind of modification. My point is that, in the Ministry of Health's recent guideline that has come for quarantine specifically, if somebody is asymptomatic and has come in contact with a COVID positive patient, then the guideline says that you have to be at home for a few days, for 7 days if I'm not wrong, and you don't have to get yourself tested but monitor your health. So can there be some kind of a category that can be made, maybe, for high risk individuals, there can be this provision of quarantining at home at least for 2 or 3 days, I mean, whatever it can be important?
No, see, if the doctor, as I said, if the exposure either is high risk or it's a low risk exposure. Low risk exposure, we do not need to do anything. Okay, they can continue to work with their N95 mask and all the precautions. It's a high risk exposure and the doctor or healthcare worker is asymptomatic. Then I think they can continue to take usual precautions and continue to work. If they are symptomatic, obviously then they go the other way where we test them and isolate them and give and treat them. So that is how it should be done. Because again, as I said, everybody, the thing is quite rampant. The virus is very rampant. Almost every other family has got it. And all of us do get exposed in the hospital. And if all of us are sitting at home, then who's going to look after the patient? So I think that luxury is gone now. Those days are gone. We have to make do with what we have.
All right. So thank you very much for joining us here on Mirror Now and explaining to us the rationale behind what is mentioned in this particular circular. We'll see how Lady Hardinge College really now responds to it, because now the resident doctors have also put in a request regarding this. Thank you for joining us for the moment. We have